Antibiotics. It may surprise you to see antibiotics on the list of things that I think that we need to talk about when we're talking about end-of-life care or completing an advance directive. They're very well known. I'm sure that you've been treated with antibiotics at some point in time. But I want to take a moment to talk about them and to think a little bit more carefully about their use in the context of end-of-life care. Antibiotics treat bacterial infections. They've transformed medicine and have saved countless lives. It's important to remember that antibiotics have no effect at all on viral infections. By definition, they treat bacterial infections. And so they're not always used in care because somebody is actually experiencing a viral infection. They would have no impact whatsoever on that. Some antibiotics are taken in pill form and others are administered intravenously. We don't generally think about the side effects of antibiotics because they're so useful for treating bacterial infections and for saving lives. But it's important to note the side effects when we are more weakened or more frail and for people that are at end-of-life care. They can have a lot of side effects like causing diarrhea or making people nauseous. People can have allergic reactions to antibiotics. Long-term use of antibiotics or overuse of antibiotics can cause liver or kidney damage. And it can also even create abnormal heart rhythms. All of these things are things to think about, particularly when a body is already weakened. If they have immune-compromised situations, from cancer treatments or from other immunosuppression drugs, or if they're dealing with other conditions, having to also battle any of these, just even simple nausea, may be too much for somebody to take. So we need to think again about antibiotics. We generally always assume that they're a good thing, but there's a cost for antibiotics that's kind of surprising. Before antibiotics, pneumonia may bring about a painless end to someone who is struggling to breathe or who's experiencing significant pain. Administering antibiotics may actually prevent this death, may prevent a natural death, without causing a significant improvement in quality of life. In fact, pneumonia used to be called, another edit. In fact, pneumonia used to be called an old man's friend. It was something that was welcome as a painless way to exit life. Once we started administering antibiotics, pneumonia was prevented, sometimes actually keeping people alive for far longer than is really comfortable or very kind.